Good afternoon. It will be a short update today. Across Canada, there have been over 12,500 cases of COVID-19 and 187 deaths. There are no new cases of COVID-19 in Prince Edward Island today, and our total remains at 22. We've received 169 negative tests back since yesterday, and 6 of our cases are now considered recovered. We continue to wait for test results to come back, but it is not a time for us to become complacent. Nova Scotia, New Brunswick, our neighboring provinces are having increasing cases, and our concern is around community transmission. It is not the time to take comfort in 0 cases. We are no means across the finish line in this pandemic. In fact, the finish line is nowhere on the horizon for P.E.I. As a physician, as a mother, as an Islander, my concern is that Islanders may think we are out of the woods with another day without cases and may ignore the public health measures, creating an opportunity for community transmission of this contagious virus. If P.E.I. experiences widespread community transmission, we will be greatly challenged in containing the virus. Our healthcare system will struggle to care for those who need it. Our whole system will struggle to maintain essential services. A key way for us to prevent Islanders from getting really sick and dying is to continue to do what we are doing to minimize the spread of the virus and the potential of what could happen here. We know we cannot stop the pandemic from coming, but we do know what we can do to slow and limit the spread. We can stay home, practice physical distancing if you have to go out for essentials, and self-isolate if you're returning from out-of-province travel. Most Islanders, by far the majority, are working so hard to comply with all these public health measures, and I want to thank you. Thank you for your compliance, for making these really tough behavior changes for all of us. We say every day we're doing things that we haven't had to do before. We work differently. We're living differently. It's not easy. But for those of you who are not complying, I urge you to take this seriously and look at what is happening around the world and across the country and why these measures we're putting in place are so important. It is making a difference. It will make a difference. Thank you. Et puis en français, partout au pays, il y a plus de 12 000 cas de COVID-19 et 187 morts. Il n'y en a pas de cas nouveaux ici de COVID-19 à l'île du Prince-Édouard, et puis c'est encore à 22. On a reçu 169 tests négatifs depuis hier, mais on attend d'autres résultats. 6 des cas sont recouverts. Et puis on attend, comme j'ai mentionné, on attend encore d'autres résultats. On voit partout au pays, au Nouveau-Brunswick, à Nouvelle-Écosse, encore des cas et la transmission dans la communauté. Et chaque jour, il faut mentionner l'importance de avoir la distance physique, rester chez vous et de s'auto-isoler si vous retournez dehors du province. Et ces mesures de santé publique seraient tellement importantes ici à l'île du Prince-Édouard pour nous protéger dans les semaines qui suivent. Je vais laisser pas beaucoup aujourd'hui et je vais maintenant demander pour les questions. I'll open it up for questions now.
Isabella Zavarisi, CBC.
Hi, Isabel.
Hi, Dr. Morrison. I'm wondering what connection, if any, there is between the cases that we've had and if these cases at all are related.
So in Prince Edward Island here, we are obviously releasing the age ranges, the county, whether they're travel or international travel or interprovincial travel or community transmission. We are giving some sense of the overall symptoms, but we're and obviously if there's an outbreak at a facility, we can talk about how many would be in that facility. But really, for the sake of trying to link one case up to another, we're giving quite a bit of information out, and I think that that will be certainly available as we go forward on the website, and we'll continue to do that. But trying to do more than that, I think, may compromise individuals' privacy.
Okay, and my follow-up is, what is your reaction to the U.S. President ordering 3M to stop exporting N95 masks to Canada?
I mean, I think that is a question that I know the federal government is dealing with today, and I believe Dr. Tam was addressing that question a few minutes ago. It's I'm hoping there'll be a solution. I think some of the materials they use even for the 3M masks, I believe, are made in this country, and it is a time for us to look after our neighbors and those in the country. But this is a global pandemic. It is not a time for us to be only looking after our own citizens. But certainly my priority is Islanders. But I think it's. I was surprised to hear that announcement yesterday.
Thank you so much.
Nicole Williams, CBC.
Hi there. Yes, I know that you're concerned about privacy, but I am wondering if there's anything you can confirm about the connection between cases. Like, do any of them work together? Are they family members? Were they on the same flight? Not identifying anyone, of course, but is there any connection like that?
So none of the cases, so the cases all to date have been related to international travel. So it is possible that you had more than one person who was traveling together. For instance, if there was a couple who may have traveled, that there may be that included in those cases.
Thank you. And I'm also wondering if you can just clarify exactly what the process is at the airport right now. We've obviously heard a lot about the bridge and the two-step screening there. And we know that everyone who comes into the airport is being followed by public health. What exactly is the process at the airport? So
they're asked the same kind of screening questions they are at the bridge in terms of questions about their health, that given information about self-isolation and how they, who's going to help them self-isolate, and their name and their contact information, where we can get a hold of them, because as I mentioned, we are now not only just screening them, we will be now following. Certainly it started some yesterday, but starting today for sure, everyone will be followed for the 14-day period of self-isolation, and they will be contacted, and if we cannot locate them, then we will be asking enforcement to follow up.
Thank you so much.
You're welcome.
Todd Battis, CTV. Hi, Doctor. Thanks for taking my question. This obviously will be a busy day for a lot of islanders who want to get to grocery stores, pharmacies, and the like. And we had just heard from Dr. Tam on this, but I'm wondering what you're advising islanders in terms of wearing masks, because we know now the CDC in the U.S. has suggested that there could be some benefit to it. There's been, certainly on social media, a lot of sharing of homemade masks being worn, coverings. How would you advise islanders?
Well, I think I didn't hear all of Dr. Tam's response, but certainly I guess multiple parts to that question. One, I think we have to remember what we know about the virus, and we're still learning lots about the virus in terms of the science, but social distancing, staying at home when you need to, and making sure you self-isolate, still really important part of that, and hand washing, really important part. Some of our masks, of course, of the medical masks should be used by certainly frontline healthcare providers, but I think you'll see not only in the CDC, but I would anticipate some of the guidance in Canada may change as well around the masks. We have to remember that masks would not be useful at protecting you, but they would be useful, and I think we're learning more how useful they could be in protecting others if you do not have symptoms. We know that people who have symptoms certainly should be wearing a mask, but people with symptoms shouldn't be going out to the grocery store. But so I think it's changing, and I think we'll continue to hear a lot of discussion about masks in the next little while, and I also think it's different if there's a lot of evidence of community transmission versus a place like P.E.I. that doesn't have that kind of evidence right now versus somewhere else. So what I'm saying today may be different as our epidemiology changes.
That's great. Thank you.
Mike Robar, The Guardian.
Good afternoon, Dr. Morrison. I'm just wondering, so you seem to be today particularly concerned with the potential for community transmission here on the island. How fast might we see an increase in the number of cases if we were to experience community transmission here?
Well, I think it's not been a particular concern today versus yesterday. I think we've been worried about it all the way along. We're seeing more community transmission in other provinces with the new cases. And I think we're testing a lot of people who are negative, which is an indication that we don't have that community transmission yet. But I think you are correct in that if we do see community transmission, it could happen quickly. And I think I may have referenced this example previously, but a case in Newfoundland where primarily they've had cases related to travel, but then they had one case that was related to almost 100 other cases, and that was because of exposure, and that really impacted the number of cases they had. So it's an example of how quickly it could happen. It's also why it's important to limit we talk about not wanting to have big gatherings, and because that's where it can spread. The more people you're in contact, it can increase that potential.
Okay, and then just as a follow-up to that, if we were to see it, are there any other precautions that you would demand islanders take, or recommend islanders take rather, to further limit? Like, is there anything else we could be doing to limit community spread?
Well, I asked myself that, and I know right across the system we're all asking ourselves, what else can we do? And we know that physical distancing will be really, really key. And it will be even more key if there could be such a thing as community transmission if we start seeing that here because of how the virus is spread. I think trying at this point in time to make sure those who are at risk, particularly who may be coming in from out of province in terms of transmitting the virus, self-isolate, really important. And we're doing a lot of the things that we know we need to do. We have focused on screening. We're focusing on increased testing so we can early identify people, and the contact tracing will be really important. So I think continuing to do what we're doing now and reevaluating it every single day, which we're continuing to do.
Thank you.
You're welcome.
Rachel Collier, Eastern Graphic.
Hi, Rachel.
Hi there. I'm wondering if you might have a quick update about how many retired nurses and nursing students, respectively, might be available to help out if needed.
You know, I actually heard the number this morning on a call, and I don't have it here with me. So if we can, we can email that to you, or are happy to bring it back next time, because I know it's an active thing that they're looking at and they're continuing to update. So I don't have that number right in front of me, and I may have missed it on the call this morning, but we can certainly get that to you.
Okay. I guess in that case, I'll ask another question. There's the idea out there that fines for people gathering in groups of more than 5 people it might affect those who are most vulnerable or who simply need support in one way or another. And I'm wondering if you might comment about this and just answer what you're weighing in the decision to fine people who are gathering in groups of more than 5.
Yes, and I mean, I think that the number in terms of mass gatherings is the same in Nova Scotia, for instance. So and we've said right from the beginning, we did not put a larger number and then get it smaller and smaller. We've said right from the beginning, there's risk in gathering in any kind of group, and that's outside your sort of unit where you live, if you live in the same dwelling. And absolutely, we all are needing the social connection, but I think we're trying to make sure we think about other ways to connect. And are there other ways to support each other and to be connected that we aren't used to doing? And I've said here before, it's such a balanced use of authority that I think education is really important, making sure people understand and maybe have the supports they need to be able to, whether it's self-isolate or if they need groceries. So those are the questions, and those are the education certainly being a big early part of this approach. Having said that, having, and that's why we don't want people to go to a big concert and gather, because then if you get community transmission and one person is sick there, then it impacts so many people, all the people who were there, plus all the people they live with, and then it quickly spreads. But it's really a balancing act, and it's trying to recognize the need for people to have that connection, but yet we know that if it starts to spread and people get sick and unintentionally people who may have underlying health conditions or are elderly get impacted, they increase their chance of having very severe illness.
Thanks for that.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Good afternoon, Dr. Morrison.
Good afternoon, Carrie Wynn.
I'm just wondering, basically how the people are doing that have been diagnosed with this amid all the numbers and the fears that people have and adjustments and financial worries everybody has at home and their restrictions. It seems that people are forgetting that this is about real people that have been diagnosed with this, and people wanting on social media, and I'm sure those that have been diagnosed and are at home can see it as well as any of the rest of us, wanting to know their whereabouts and their counties and all that kind of thing, and almost making them feel as though they were criminals. So we're kind of forgetting this is a human issue here, and people have been diagnosed, and I'm sure they're very scared. How are they doing at home, and what are they experiencing in regards to symptoms and their severity, and worrying about then what will take them to hospital?
Yes, so Carrie Wynn, it's really a good question, and I've had a chance to speak with most of the cases, and I think they are often scared of the diagnosis and what that could mean. How much sicker will they get? And I think we've been very fortunate at this point in time that the cases are not hospitalized. We have 6 who've recovered, and they have a range of symptoms of relatively mild symptoms at home. But it's of course, it is upsetting for people to get the diagnosis because they are worried. Are they going to be in the 80% of cases that are more mild and do not end up in hospital? We have 15% of the cases in this country, over 15% of the cases in the country who have been hospitalized. Over 4% of those in the ICU, and how will they end up in those situations? So it's very real. It's and we know that there'll be many more in this province before this is over. And remembering that it can happen to any of us, and that's why we're putting all these measures in place to try to reduce that possibility.
And I'm just wondering if you can clarify something from yesterday, and maybe it's a question for government officials, but yesterday afternoon you mentioned that warnings and that were still being given, yet previously on the Monday prior, the Premier had mentioned it's no more warnings. It's time for action, and people are being fined if they are not, following the protocols. Are there still warnings being given, or is everybody just going to be fined now?
No, I mean, I think we continue to receive complaints through to our office, but also Crime Stoppers and police have received some complaints, and they have made some verbal warnings, some written warnings, but there have been 3 charges laid, and I think it's depends very much on the circumstance, and I think the Premier was referring to the fact that we need to all take this seriously, and so it's from the point of view is that we're not just wanting to tell people to self-isolate, but we need them to take it seriously to protect our community, and by far, like I mentioned, by far the majority are doing so, and in doing so, they are looking after their families and their community. So I think that those the enforcement folks are just working really closely with us, and we'll continue to see changes in those numbers. And those numbers, or those 3 charges were of since I think the 2nd, so or yesterday. So those numbers may need to be updated.
Thanks so much.
You're welcome.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. Je voulais vous reposer une question par rapport à ce que vous avez dit. Vous avez dit la ligne d'arrivée n'est pas encore visible pour la pandémie. Néanmoins, est-ce que vous avez des discussions au niveau fédéral avec vos collègues sur comment le déconfinement va se passer? Est-ce que il y a une crainte d'un rebond de l'épidémie si on dit aux gens qu'ils peuvent sortir trop tôt?
On a commencé ces discussions avec mes collègues et ça va ça va continuer. C'est des discussions qu'on commence parce que on sait même dans d'autres pays, s'ils commencent à enlever les mesures, on voit des cas qui commencent encore. Et alors c'est quand et comment on peut comme enlever les mesures. Et alors c'est une discussion, une très bonne question et on y pense tous les jours. I'll just relay the question in English. It was, am I talking with my colleagues across the country about when we may end up being able to lift these public health measures? And we absolutely are having that conversation, and they will be difficult choices too as we watch around the world when some of these public health measures, they start to be eased and lifted, then you can sometimes see an increase in cases. So it's a discussion we need to have ongoing and will be a really important one.
Merci.
Wildenette Paul, Radio-Canada.
Merci beaucoup. Docteur Morrison, ça fait déjà 3 jours qu'à Lille, on n'a pas de nouveaux cas qui sont annoncés, alors que les autres provinces de l'Atlantique annoncent tous les jours de nouveaux cas. Quel est votre message aux insulaires aujourd'hui, donc aux résidents de Lille?
Mon message est de ne pas ne pense pas que on n'a pas, ça va pas arriver ici. C'est le moment de penser qu'on fait les bonnes choses, mais qu'on doit continuer d'en faire. Et sinon, on va voir les mêmes sortes de choses partout, qui arrivent partout au pays. Okay. Thank you very much.